Hi, and welcome to another episode of Coffee and Lipstick with Neha. I'm Neha Karina. This month is all about Breast Cancer Awareness Month. Previously we had another gynecologist here and she gave us a lovely introductions to PCOS, and we have to continue doing these episodes to inform ourselves with these different topics for women, because Coffee and Lipstick is all about a woman coming together to create a space for us to understand and support and empower women. So today we have Dr. Sabrina Deonarine, who is a qualified doctor, and she's very youthful and beautiful. She's done a lot for her youthful age and she's brilliant at what she does. She's an icon and influencer on Instagram that educates us towards actually informing us on certain duties towards our body, such as taking care of our body, what we should look for when having problems such as breast cancer, PCOS, the basic things that, which is knowledgeable to women in our society that is needed to know so we can take care of ourselves. So my advice to you is to take a cup of coffee, I think, and stay tuned. It's Breast Cancer Awareness Month. It's October month. And who else I can think about but bringing on set is Dr. Sabrina Deonarine, of course.
Hi, how are you? That's so nice to have and be on this set. I love the setting. I think it's just so chic. So I appreciate it. You have my support, and I love to raise awareness and, just bring that sort of energy into the month, and especially as it's Breast Cancer Awareness Month, I have to say yes.
Thank you for joining us. So tell us, who is Sabrina Deonarine?
Oh, I don't know. Sabrina Deonarine is my married name, and I am commonly or more friendly known as Dr. Bree. I started an Instagram page a couple of years ago, and the main aim of the page, as well as what I stood for and stand for ever since many years ago, is just more about being that relatable woman, that professional woman, that woman that people can look up to. And I think I get a lot of inspiration from my mom, because growing up, as you know, in Indian families, our moms are all about traditional, and they like to, give us good morals to live by, good traditions to live by. And I think growing up, mommy always instilled, be the best that you can be, inspire people, motivate women. And she herself was my motivation and my reason for a lot of the things that I ended up doing and going for and being driven about, because she would always instill getting up early, making sure you have a good routine, taking care of yourself, and just inspiring others.
You are known as Dr. Bree.
Yeah.
You are known as an influencer, Instagram influencer, Dr. Bree, because you spread awareness for different causes such as PCOS. For even you share light to supporting women. Like, you build that platform where you're able to support other women businesses by your friends in society. So you've built your name in such a way that you're a support system for women. How do you feel about that?
I just love the energy, and I am all about when I see women going off and being entrepreneurs and following their dreams and taking a leap of faith and doing things that they're uncertain about, you have to admire this, and you have to admire a woman's strength and courage. And I just find that in Trinidad, for example, it's always good to give that energy to other women. And across the world, you see that women are supporting women. You have women empowerment, you have the drives, you have basically you want to be that woman that supports instead of bringing down other women. And I'm all about, every time I see something or I see like a young entrepreneur, I would love to bring awareness to her, and I use the forum and my page to sort of network women to other women. As you know, you are in this industry as well, and you're all about encouraging women as well. And I think that energy that we give each other, I think that's what we need to continue to do that, because who else is going to support us? Who else is going to empower us? Who else is going to inspire us but our own selves and each other, and being a sister's keeper?
Yeah, and I see a lot of fun gifts you get from all your mummies and friends as well, and it's really encouraging to see that they support you in such a way that you did a fantastic job to fulfill that. how's your day like, and how do you feel when you receive these loves and
I mean, absolutely, humbled. My heart is always full. I'm always very excited to go home and share things with my husband. So sometimes I may get, food things. Like just today, I got some Indian food that I'm excited to go home and share with him. But the thing is that I don't expect this from women. I don't expect this from anybody. You never really say, well, you're doing a service for man, or you're doing a service for your patients, expecting anything in return. But I always tell them that I appreciate, and I think that that's the important thing. Don't bring me things, but if you feel like in your heart you want to gift somebody with something, or your doctor with something, I mean, we're obviously never going to refuse things, but it's very nice to receive, and it's very nice to be appreciated, and I always am truly grateful. Every day I say I'm blessed, because there's just some woman that will bring a smile to my face by just a simple gesture or something kind.
So we have the young generation, we have the older generation. Do you feel that there's like conflict where you share your love with your medical team, you have staff, you have your assistants, and when you go, you talk about women bringing down each other, and then you get a lot of gifts from your people, your I should say your followers. You get gifts from your patients. You think people may be jealous you for these things? Or?
I don't think so. I think when you receive things from people, you always do it with an open heart, and I think that when people are giving, they also give with an open heart. I always throw it out there. I'm not an influencer is a I would put that in brackets, or in those we say influencers. I don't want to say that I'm an influencer that sort of does things for monetary gain, because of course in my medical profession that's not the avenue. I'm not in advertising. I just have a page that has gotten quite a lot of followers, a lot of love, a lot of respect, and I use the page more for helping others. Giving of myself free of charge. I don't really charge for things that I do on the page. I always try to tell people that I don't want to do it for advertising purposes. Just the other day I had a contract. One of these companies tried to get me to do a contract, and I said, no, I'm doing this for free. I want to educate, I want to empower, share knowledge, and you don't need to pay me for that. So they said, well, Doc, is there something that we could send for you? Are you sure you're going to do this without anything? And I said yes, because at the end of the day, you sleep better knowing that you do things with a good heart, and you do things for service to mankind. I mean, at the end of the day, we don't need to get monetary gifts for that. We don't even need to get gifts for it. But at the same time, receiving things is really, really, I'm blessed. I really am.
You're young and beautiful, I will say.
You.
Your youth says it all.
As are you.
I'm still a child at heart. And you're a doctor. When did you think that you wanted to go into gynecology?
Well, gynecology, first of all, I think I wanted to be a doctor ever since I was a couple of years old. Mm-hmm. And my mom was actually bringing this to my attention many years ago. She was cleaning the house, and she found some prescriptions that I had written when I was, I think, like 5 or 6 years old.
Wow.
And what she would tell me is when we were in family functions, I would go around by every aunt and cousin that I had, and I would say, do you have pain? Where do you have pain? Let me write you a prescription. And she said that all I would write is a prescription, and I would put Panadol. So I would give everybody Panadol. But at this young age, I was actually focusing on doing these things, caring about people, caring about, pain, trying to prescribe things. So I think that it's always been in me. But what inspired me with gynecology is really just understanding and appreciating and loving women's health. I mean, they always say do something that you love and do something that you have a passion in. And many times when I was an intern and I was on the wards and I was kind of rotating through all the different rotations, nothing would excite me. I don't want to say excite me, but I wouldn't be as motivated as when I was in my gynecology rotation. And I was heavily inspired by doctors like Professor Ramsawak. When he had started the IVF clinic, I had actually gone in and I was doing some rotations with him. And that's when the love for getting women pregnant, the love for taking women through their pregnancies, just being there at every milestone of a woman. That's when I said, have to do it. And I never went into any other profession. I've been doing this profession for a little over 11 or 12 years. And, no regrets. I wake up every morning excited to go to work. I never really take a sick day. And I think that's when you're doing something right. When you actually just don't feel to not go to work.
That's true. So tell us a little bit about, let's talk about your practice. In terms of your practice, let's hear how your daily routine goes.
Right, so I get up at 6 in the morning. As soon as the sun comes out, I'm up. I check my phone. I'm usually looking at emails just to make sure I have nothing urgent to attend to. Jump in the shower quickly, prepare some coffee, get something to eat like a granola bar or muffin or something that I try to be healthy with. Prepare coffee for my husband, and then I run out of the house. As soon as I reach to work, it's just patient, 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 patient. And we just go like that, it's just a constant daily. Sometimes I may get a call, a patient's water bag has burst, so I have to leave that office and run straight to deliver. But that's my day. Unpredictable, never know where you're going to be. And that's what I love. I think that I was never an 8 to 4 job. My personality, I don't think suits that 8 to 4. I think I always loved the, running around and the spontaneity of it and the uncertainty of it, and I really think that that's what keeps me going. Then the end of the day comes and I have to go home and I have to be a wife. So right now I'm thinking to myself, my husband's home, I hope he has something to eat. We try to exercise, so I try to put that in, and then I hit my bed at 10, 11 at night.
Don't you get exhausted?
I don't. And I always wake up every morning and thank God that my energy levels are up. And I always have that energy to inspire, to motivate, because, I think the day that I lose this energy, I don't know, I wouldn't know what to do with myself. But the energy levels have always been high.
So on the basic level of going to a gynecologist, so what happens when you go to a gynecologist? The first thing they ask is for, what is really, to me, is like when you go to a gynecologist and, they'll say, have to give you this, you want to know an answer. And they said, okay, you have to get a ultrasound done. At your office, you do it, right?
Yeah. So I trained in ultrasound as well, because to me, a gynecologist, it's always nicer and easier to do bedside diagnostics.
Right.
What I used to find is kind of seeing a patient and then referring her to do the ultrasound at the radiology department, bringing her back on a second visit. I just find that kind of breaks the management and the energy and that connection with that patient. So every time I decided to improve my skill set, I did ultrasound, I went up and I did a laparoscopic training course, so that is where we do minimal invasive surgery. So I always look for the next thing to do, because
right, to keep yourself advancing.
You have to, because in this industry you cannot just stay stagnant. You have to keep looking for what's new, you have to be current, you have to be updated in terms of what you can offer to patients, because I always say patients know so much. They Google everything, and even though we shouldn't Google too much, patients are very aware. And you have to be just as aware as them, and you have to say, okay, what you've read here or what you've read there, because they basically have a lot of access to information, And so I do the bedside ultrasound, and that way I'm able to sort of diagnose at the same time and be able to sit with that patient after and say, okay, this is the case. You would see from some of the videos with some of the girls who've shared their experience with the office. I like to point out things, so I would show you on the ultrasound screen, this is your womb and this is your ovaries. And women always like to hear that the ovaries look good, or that their womb looks good. And I think it's in understanding your body, and that's really what it's about, explaining to patients, because that's what they tell me. They say, Doc, I appreciate the fact that you've explained to me. I really didn't know before that my womb may have been tilted backwards, or I didn't hear that before. Because when you go to a radiology department, they may not necessarily discuss these things with you. They give you reports and they say, okay, we'll check with your gynecologist.
Yeah, and it's a bit tedious, to go and then come back. And
well, that's the thing. So that's why I've tried to make it such that it's a one visit. We do everything that we could possible to help better understand what's going on with you, and then we sit and we talk about a management plan, and send you off to do your thing.
So tell me a little bit about, I've seen on your Instagram a lot of women are actually coming to you because they can't get pregnant. And you're promoting a lot when it comes to getting pregnant, that you can help them, especially in a mature level of the side. Is it that right now you're doing surgery for that, you're helping them solve it? What's the process happening at Dr. Bree's office, at your brand, your medical facility?
So the thing about it is that, I always try to evaluate couples properly first.
Right.
I'm not here to replace an IVF or fertility clinic.
Okay.
Because at the end of the day, there is a rule for going straight to a fertility clinic and not coming into a gynecologist. But I'm actually not the only gynecologist that does this. There are a lot of us out there that we try to help you with your fertility as far as we can take you. If we can't help you, so for example, we would assess our men, have them do a semen analysis, have them see a urologist. With respect to my woman, I would sort of look at their ovaries. Are they polycystic? Do they have fibroids? Do they have things like polyps?
But sometimes you perform surgeries for such?
Sometimes we may have to do so because there are things that can affect or prevent getting pregnant. So at a gynecology level, like as in my level and not a fertility clinic, I can help to these extents. You do your investigations on your couples, you make sure that everything is okay for you to work with. And I always tell patients, this is a journey. There's no 100% guarantee that I can get you pregnant, and that's what I think is important. Once you understand that this is a journey, we can try different things. A lot of the times pregnancy and trying and success comes from lifestyle. How are you eating? Are you exercising? I sort of try to guide them in terms of what treatments, tablets, vitamins, what should they be doing, what should they be on. I always also recommend like a trainer or nutritionist because I think that you cannot do this alone. And you have to have that hope. You have to have that belief that it can happen. Because I've had patients who they've been trying for 9 years and then they come in and we get success. So a lot of the time I also think it's energy. I think it's, are you relaxed? Are you stressed? What have you done before? We're not going to do the same thing that you've been doing for so many years. Let's change it up a bit. And I do everything as medically safe as I can. Sometimes we may not have success. Sometimes, and most times, a lot of times, we have been having a lot of good success recently, especially with the girls over 35, which we call advanced maternal age.
So another question I have for you is that what do you think about right now in terms of what are the norms that are facing for troubled pregnancy?
In terms of what may be affecting
Yeah.
couples? I want to say that I think it's our lifestyle and I think it's our environment. And, back in the days when your grandmother had 16 children or 10 children, why is it that young couples in their late
Is it the
20s are
food?
struggling for one? I think it's the food. I think that it's radiation exposure from our phones. We've gotten very industrialized and we've gotten very chemical. Our whole life, even though we want to think we're eating vegan or we're eating organic food, everything has just become very chemical. And I think that that's part to play. We don't have enough literature or enough studies to say this or that, or, we've proven that this is the case. But we see the change. I mean, our grandmothers they were highly fertile. You're talking about 10, 16 children. And then, as I mentioned, you have couples now who are struggling to have their first
That's
child. And I think a lot of it too is busyness, scheduling, the fact that people are not taking high stress levels. I think that this is the problem because nobody's relaxing anymore on getting pregnant. It's all about, I need to get pregnant now, or, I need to do this, or my husband's offshore. And so I think that everything's a lot more high pace.
High pace.
And I think this is where the problem lies.
So a lot of people you have met upon your lives that they come to you, they have made a great impact to you. Who is one person that you admire in your medical field that has made a great impact to you, that that made your career into what you wanted, that molded you and created you and there to guide you?
Yeah. I would say that, as I mentioned, and I'm all about women, but I have to say, and I keep saying this, Professor Ramswak, I don't know if you know him. I mean, he's been around in this industry for a long time. His gentleness, his bedside manner, the way that he manages and cares for patients. He's doing this whole thing with the IVF clinic, and they have been so, Dr. Minto Bain as well too is side by side with him. And these are the Dr. Adesh Surju Singh, I know I'm calling men and I'm kind of being contradictory to supporting women, but these are the guys that have inspired me. Just the way that they conduct themselves and the kind of quality of service that they give. I think that it definitely has shaped me into who I wanted to be, and who I hope to be.
So before we shift to breast cancer awareness, let's get to know a little bit about Sabrina.
Oh no.
So what's your favorite food?
So my favorite food is actually Thai food.
Thai, okay.
Love Thai. I think I have a spicy Palette,
What do you
yeah.
think about Indian food?
Love Indian food. Actually, just love authentic Indian food. I also, I mean, Chinese. Nothing beats back good Chinese. But generally, I don't think I have a favorite food. But I really do think that Thai is like, I would go to Thai a lot because I think that I just love the spiciness. I love the fusion of it. You know.
If you have to choose between water and soda.
Water. I would definitely say water. The only problem is I find that water is so difficult to drink sometimes. And you know, as gynecologists, we would advise you that you should take like at least 1.5 to 2 liters of water a day. And I find I struggle to even drink half of a liter of water. I think sometimes putting things like rough skin lemon or just trying to like change the taste of the water is also good. I do, however, love Coke Zero, but
You're a Coke lover secretly.
I'm a secret Coke lover, but more I try to do the Coke Zero. We definitely try to do like less sugars, but as you know, things are changing, and you never know what's going to be harmful in a couple of years' time. So you do your moderation. You know, you do everything in moderation.
So on your menstrual cycle, since it's a whole, you have any craving?
I do. I crave Haagen-Dazs.
Wow.
So I actually crave ice cream.
So you give your husband a hard time?
Awfully hard time.
Do you get moody?
Do I get?
Moody.
I don't want to say so, but then you know, you as a woman, you never know how moody you are. You actually have to hear it from other people. Well, no, I think that he says I'm slightly different, but I think he said the last few months have been a lot better.
How he copes? I mean, you're all two different arrangement. I mean, you're a doctor opposed to he's a pilot.
Yeah, you know, it works, and I think what the key is, because I'm newly married, just a couple of years, but
I told you your youth says a lot.
Yes, but the thing about, I look young, but I'm actually not as young as people think. But you know, I wouldn't give up my age, but I think that, you know, thankfully I come from a line of women that they look young at an older age. I mean, my grandmother was 70, and if I show you a picture, you'll be like, no way.
I had a chat once with your dad, and he was like, "This is Sabrina's mom," and I was like, "But she looks like Sabrina."
Yeah. So mommy has been looking really lovely and youthful for a very long time. Which I missed what we were talking about.
We were talking about oh my god, you forgot your husband.
Yeah.
We were talking about how it works
Yeah. So I think that's what I was saying. I was recently married. I'm learning as I go, but I think the key to marriage is space, and I think the key to marriage is appreciating and respecting each other's careers.
Right.
You know, he knows that I might have to run out of the house at 11 o'clock in the night. He knows that I might be away till 5 o'clock in the morning, because babies sometimes are going to take hours before they come.
Does he like babies?
He loves babies, and even though I maintain confidentiality, so I would not really go home and tell him about any of my patient experiences, but you know, I share, the mummies send me pictures of the babies, and they're so excited to share the babies on the page as well.
And he's your husband as well.
Well, so that's the thing. So when he sees the babies, he goes, "Oh, that's the baby you were delivering, and you know, that's why you were away for so many hours." But he's always very happy when things go well, and he is my biggest support.
Positivity is a very, very key thing in life.
It is, and having a supportive partner, I think, is, you know, just as key, because you can't do this alone. You know, he just kind of keeps everything up, and I mean, we are looking at wanting to start a family as well too, so we really need to find that balance, you know.
It'll happen soon.
Thank you. So somebody told me, my patients actually come in the office and they say, "Doc, I dreamt that you got pregnant 2 months ago. I dreamt that you're going to get pregnant in December." So the energy, I accept all of the positive energy.
Okay, so what is breast cancer?
Well, breast cancer is a very common cancer that affects women, and it usually affects women more so in their 40s, 50s, 60s. It is a cancer that you can detect early, and if you detect it early, you can make a huge difference in terms of what you do from that point. Because, you know, years ago, women were detecting cancer late, and they would have to end up doing mastectomies, or they would have to end up removing their entire breast. That created a big psychological problem for women, because, I mean, to lose your breast as a woman, I can't think of anything worse, you know. And what I think has changed is the fact that we are now promoting and encouraging early detection. And early detection just simply means getting in tune with your body. trying to figure out if you have a higher risk factor group. So asking your aunts or your cousins or your mom if there's any family history of breast cancer is one important thing. I find that when patients come into office and I ask them about breast cancer history, half of them actually don't know, because nobody in the family shared with them that they were a breast cancer survivor, or they might have kept things quiet. And I think that that's important to know your family history. The other thing that is scary about breast cancer is that you may not have a family history and you can get a lump and you can get breast cancer. So I think getting in tune with your body, as I always tell women, your body speaks to you. It's going to tell you if something's wrong. If you find that you feel that you're having some sort of lumpy area, or you're in the shower and you find your hand passes by and you feel something unusual that you haven't before, check it out. A lot of women, I think, run away from checking things because I think they're afraid of the results. They're afraid of, am I going to have breast cancer? Am I going to be that unlucky person? And breast cancer happens in 1 in every 8 women. So it is common. That is pretty common. That means that 8 women, one of them is going to be diagnosed in their lifetime with breast cancer. So I think we need to, like cervical cancer, we need to keep promoting early detection because it makes a huge difference to the outcome. You may not have to lose your breast, you may just have to remove the lump if it's detected early.
What is the age that you think you can detect such?
Well, more so we encourage women who are over 25 to start doing your checks, doing your self-breast checks. So that means that you feel the boobs, not when you're around your period, because we are a little more lumpy when we're around periods, but middle of your cycle, have a feel. See if you feel anything unusual. If you do...
So you check around the nipple area?
You check everywhere. So you basically check... I don't want to do the visual, but you can take your fingers.
Okay, so you can probably use
so let's do this. So the important thing
is... Make sure the logo shows.
Of course. Yeah. So the important thing is that, let's say that this is my left boob. The important thing is to really open up the breast. So I always tell you, open the breast by opening the hand up, right? Mm-hmm. And then you're going to take your other hand and you basically take your 2 fingers, hardest point here, and you're working yourself around. You're working yourself around and you're trying to just rotate your fingers around the breast, including your nipple area, more importantly to the upper side of the outer breast, because that's where breast lumps are more prevalent. And you check, you feel if there's anything wrong. If there is anything wrong, then the next step is to get into your gynecologist and have them have a feel. And then most times they're going to recommend whether you should do a breast ultrasound. If you're over 40, you should do a breast mammogram as well as an ultrasound.
So over 40 is when you do the mammogram?
Yes, and the reason, you may ask, the density of your breast changes. Mm-hmm. So the breasts become denser, they become heavier, they become a little bit harder. But basically, the density changes. And so the mammogram is going to get deep inside. So it's going to really check for those lumps deep inside that we may miss on the outside.
Why do we use the color pink for breast cancer awareness?
Well, I think that that was based on a breast cancer survivor. I cannot remember her name at the time, but she, I think from what the story says, that she had started sewing peach ribbons in support of breast cancer. And I would guess that over the time the peach turned into pink. And I think pink represents women. Pink is something that all women relate to. I think every girl loves pink. So you always, with these awareness drives, you always want to get a color that can inspire or can raise awareness or raise attention.
Right.
And I think women love to wear pink. I think they feel good to bring awareness to breast cancer, in being in their pink. I posted up a picture that we did for the empowerment campaign.
I think you tagged us
and I was in the most beautiful pink that I could have found. And you feel good in pink, and I think that's where it comes from. One of our cancer survivors many years ago.
In closing, what do you have to state to women in society today, like inspiring gynecologists, doctors, women who just wants to get pregnant? What is your closing statement?
I think that I have always lived my life on the motto, think it, believe it, and achieve it. Mm-hmm. And I think that you have to really understand what you have to have a thought, and when you have that thought, you have to manifest it into a belief. Mm-hmm. And when you have that belief, then you can achieve anything. Along my life's path, I have had a lot of disappointments, a lot of setbacks. The person that you see and the Dr. Bree and everybody thinks, oh, she's so successful. But everybody comes from a place of a journey, and we all have challenges. But I think challenges help us to grow. And so my point to women out there is never let anything stop you, never let anything, steer you along or away from your path. I'm reading this book, Think Like a Monk, and it's an absolutely lovely book from Jay Shetty. And he talks to you about positivity, not being negative, just inspiring and being inspired, encouraging people, and just basically, having that calm within yourself. Every day, just taking a little time out for yourself before you go into your hectic day. But never stop believing. Always try to achieve, because at the end of the day, you'll be so happy when you reach that point that you've been struggling to get to for so many years in your life. And to, the young doctors out there, they always reach out to me and they message me and say, Doc, what was it that inspired you? Or, can you help me with this? And I think that we have to be there for younger people, because, I had mentors and they were there for me, and you have to just kind of pass the baton down. So I try my best to be there for women and just be an exemplar, somebody that people look up to and they say, I want to be that way, not that girl, but I want to be that way, so it's my story.
Mentorship is a great key, and what you're doing is quite fair. The same way you got your doctors to mentor you,
yes,
you will do the same to them, and the karma of the cycle of reaction will always go around with good blessings and souls.
Oh, that's very nice of you to say.
So thank you so much for joining us on Coffee and Lipstick with Neha. Sabrina, it's been awesome talking to you. I mean, we went from daylight to dark.
Yes.
Although this will air in the morning.
Yeah.
So thank you once again, and I hope we do this again very soon.
And continue doing what you're doing. I mean, this is lovely, getting to know women and getting to know people and doing these interviews. I think that it's really admirable. So keep doing what you're doing.
Thank you. In closing, we always have to inform ourselves the basic knowledge for women, especially when it comes to our body. Breast cancer is something that could happen to anybody. Right now in our society, we have different illnesses, different ailments. It's a sad thing in our society, and we're going to keep going on with these episodes of Coffee and Lipstick with Neha to inform you girls out there how to check your bodies, know what's happening, question yourself to always remain healthy. So till next time, I hope you grab another cup of coffee and stay tuned.